Go ahead, Robbie.
Hello, everyone. Welcome to our graduate student community seminar series. Um, Today, we're going to have a wonderful talk from Dr. Zhu. Before we get into all of that, I want to introduce the graduate student community a little bit and some of our opportunities that we have. So, are we working? First, I want to introduce some of our graduate student community members, GSC members. So this year, myself and Rachel Bennett are the co-chairs. Publicity is done by Swapnil and Avinash. Sivash is our treasurer. We have a large support team ranging from social coordinators, event organizers, everything like that. And of course, our mentor, our advisor is Professor Farouk Mistry. Um, so if you ever have any questions about the GSC, feel free to reach out to any one of us. And then we'll have some contact information right on this slide. So every week we have leadership team meetings where we plan for these webinars, other future events like lightning talks or our food festival. Um, but everyone is welcome to join our weekly meetings. They're held on Fridays at 4 p.m. And they're a hybrid this year. So they're both on Zoom and in the BERT team room in the engineering lab building. And then, of course, this time is set every semester. So the most people can attend, the highest number of people can attend as possible. So please send Rachel an email, send myself an email, and we'll make sure you get all the information on attending. Um, Beyond that, if you're not a member on Engage already, please become one. You can scan this QR code, click the link on the screen, or just search for GSC on Engage. It helps us keep funding so we can host more events like this. And like I said, the food festival, lightning talks, other events. And it helps us all stay in contact so you can keep up to date with upcoming events. Beyond that, we have a LinkedIn page. I encourage everyone to join this. Of course, you can see upcoming events. Keep pushing that one on LinkedIn too. But we're also growing our membership on there with both current students and alumni. So you can make some new connections, hopefully grow your network and um, you know, things like that. Beyond that, we also have Facebook and Instagram pages. You can scan these QR codes or search for them. More of the same stuff. Keep up to date on events and build your network with current and past students um, involved with the GSC. And then one of my favorite is you can also check out our YouTube page. Um, Again, QR code on the screen, or you can search for us. Uh, on the YouTube page, we have previous seminars and webinars that we've recorded over the last 4 or more years. So if there's any that you've missed previously, you can catch up on them here and reach out to those professors if you want to collaborate or you have questions, or if you just want to watch to learn more. Beyond that, I mentioned we have our team meetings hybrid. So this is a picture of the Dave and Susan Burt team room in the engineering lab building. Um, any GSC members, anyone that wants to join the GSC will have access to this. So there's a few amenities in there. We have couches, whiteboard, coffee pot, microwave, and it just uses card swipe access. So if you'd like to join the GSC and have access to this room, participate in our team meetings, just send us an email and we'll make sure you have access. Uh, in just a few minutes, one of us is going to put an attendance sheet in the chat. So please sign into that. It's just a quick Google form with your name and email. It helps us keep track of who's attending and again helps us maintain funding so that we can keep doing these webinars. All right, so that's my short little spiel. With that, I'm going to pass it off to Dr. Zhu for her presentation today on smart healthcare through multiphysics simulations and survival predictions. So I'll stop sharing and invite you to the stage, Dr. Zhu.
Okay.
Can you see my screen well? Okay. So, thank you for inviting me to be here. So, I was here to give a presentation back in 2022. So it's great to see the GSC is growing with a lot of students from different majors joining.
Roshan,
I
can
can
you
see
mute?
that. Yeah. So I can see that this is a very huge community. So it's great to see that students are communicating with each other and the students are communicating with the faculty members. And also I see a lot of students are graduating soon. So good luck with the job hunting. And if you have any questions regarding finding academic position, feel free to send me emails and I can offer some tips. And also my office is located in 116B in the Carson Engineering Center. So also feel free to stop by and chat, just have a chat with me. Yeah, so I'm Rachel, and I'm an assistant professor from the School of Industrial and Systems Engineering. And the topic of my presentation today is smart healthcare through multiphysics simulations and survival predictions. So in this talk, I will present two key areas of research from my group. So the first one is about the development of multiphysics simulation for modeling cardiac arrhythmias. And the second is about the survival prediction models for childhood leukemia. So my presentation is structured as follows. I'll start off by the first part of the research, which is the multiphysics simulation. And then I will move on to the survival prediction. So after that, I'll end with the future research directions. So cardiovascular disease remains a major health challenge in the US, affecting nearly half of the adult population. Among these disease, cardiac arrhythmias pose a particular severe threat due to their broad spectrum of conditions. And the financial burden associated with managing these conditions is considerable. And mitigating their financial and health impact relies heavily on a deep understanding of arrhythmia physiology so that we can develop precise diagnostic tools and effective therapeutic interventions. So current practices of understanding arrhythmia physiology primarily focus on the electrical activities of heart. For example, the diagnostic tool used to identify the cardiac arrhythmia is the 12-lead ECG. So this is a picture of the 12-lead electrocardiogram. I believe most of you are very familiar with this kind of signals. So these are the cardiac signals that is usually collected when we visit a hospital. So these are the signals. So this 12-lead ECG records the electrical signals of the heart projected on the human body surface. So, however, the cardiac arrhythmias are complex conditions with multiple physical processes contributing to their initiation, maintenance, and progression. So specifically, the electrical impulses malfunction in arrhythmia, disrupting the mechanical function of the heart muscles. And this mechanical dysfunction, in turn, impairs the heart's ability to effectively maintain the blood flow and the pressure, thereby impacting the fluid dynamics within the cardiovascular systems. So if we could have a multi-physics simulation of the cardiac arrhythmias, that will help provide an accurate description of the physics of the heart and provide further insights into the pathology of the cardiac arrhythmias. And this will also assist in the development of the personalized treatments, and there will be no need to switch between the single physics simulations. For example, the simulation of the electrical dynamics itself and simulation of the mechanics, for example, the heart muscles. So inspired by this idea, so we aim to develop a simulation that can describe the multi-physical processes in the heart, leveraging the advancements in the deep learning. So we start with developing a single physics simulation that describes the electrophysiology, that is the electrical dynamics of the heart. So in the past, researchers simulated the physical law of the electrical dynamics with a model-based reduced order model. So which means the dynamics of a physical variable over time, such as the electrical potential over time, is described with a partial differential equation or an ordinary differential equation. However, these differential equations, for example, PDEs and ODEs, are often only partially understood and merely approximate the real cardiac dynamics. So built upon the model-based ROM, so researchers developed this data-driven ROM. So they replace the PDE, ODE equations with machine learning models to describe the system dynamics. So which brought us closer to the reality. However, it still assumed that the physical variables change with respect to time, follow a certain pattern that may deviate from the real system. So to address this limitation, we propose to replace the differential equations with data-driven recurrent networks. So specifically, we propose a data-driven and long short-term memory LSTM-assisted simulation method to model the cardiac electrical dynamics. So due to their capability of learning long-term dependencies, LSTMs do not rely on any fixed form differential equations and can simulate the long-term behavior with only sparse input data. And this work has been published in the as a conference paper in 2023 Winter Simulation Conference. So to validate the proposed methodology, we stimulate the lower right corner of a square with electrical impulses. And the electric wave then propagate toward the upper left corner. And we record the data and refer to it as the golden standard. And then we use this data set to train the LSTM assisted simulation. So as shown in the figures above, so only with a sparse set of input data, that is a few time points, or even just one time point. So the well-trained LSTM assisted simulation can perfectly mimic the propagation pattern as in the golden standard. So we also display the signals of various variables that can describe the electrical dynamics, including the membrane potential, denoted as Vm, and some other variables that can summarize the calcium ionic dynamics. So all these variables can describe the electrical dynamics of the heart. And we record the signals of these variables at 4 different locations on this square, as illustrated by the pink dots. And the blue dashed line represents the signals in the golden standard, while the blue lines represent the signals simulated by the proposed method. So you can see that the signals simulated by the LSTM assisted simulation have almost the same waveform as the golden standard. And we further compare the performance of the LSTM assisted simulation and that of data-driven ROM, so which is the which describe the electrical dynamics with a data-driven model. So the proposed methodology can perfectly reproduce the signals of the golden standard. So you can see the blue line and the blue dashed line, they are well aligned. While the data-driven ROM cannot reproduce the signals in the golden standard, and the signals simulated by the data-driven ROM is represented as by a red line. So far we have simulated the electrical dynamics with a deep learning model. So we start thinking about whether we can simulate the multiphysics of the heart, leveraging the inferential power of the deep learning models. So in this multiphysics simulation, we focus on a particular condition of cardiac arrhythmias, so which is called atrial fibrillation. So in short, it is called AF. So AF is characterized by rapid and irregular heartbeats, and it is one of the most common cardiac arrhythmia. So the pathology of the AF is like for a healthy human heart, there will be just one trigger, which is called sinus node, in short SA node, to trigger the heartbeats with a frequency mostly one heartbeat per second. So people can have this regular pattern in the cardiac signals. However, in the AF heart, in addition to this SA node, there will be multiple abnormal AF trigger in the upper heart chamber, which is atria, to generate the additional heartbeats. And this makes the cardiac signals of AF patients rapid and irregular compared with healthy heartbeats. So this AF poses a particular serious threat as it significantly increases the risk of life-threatening complications such as the stroke and heart failure. So specifically, AF impairs the heart's pumping efficiency, and this will result in the heart failure. And on the other hand, AF poses the risk of blood clot formation, and eventually this will cause the stroke. And the catheter ablation, in short CA, is a commonly used approach to treat AF. So this CA treats AF by inserting a catheter into the heart chamber, and the end of this catheter will burn the muscles around the abnormal trigger. And once these muscles are burned, then the surgery will stop the propagation of the abnormal electrical signals. So accurate treatment planning is the key to a successful CA procedure. And usually we rely on the computational model of the heart to do the surgical planning. However, most of the models rely on data-driven models, and these data-driven models neglect the fundamental physics of the hearts. So to mitigate these challenges, physics-informed neural network, which is commonly known as PINN, has emerged to integrate equations that govern the heart's physical laws, for example, the PDEs, ODEs, into the data-driven models. So in the current practice, the PINN usually focuses on single physical processes. In the cardiac simulation, that is mostly electrophysiology. Well, as we just said, so AF is a complex condition with multiple physical processes, including the electrophysiology, mechanics, and the fluid dynamics. So comprehensive knowledge of the multiphysics process is crucial for designing the preventive care and the treatment strategy. So in this research, we developed a multiphysics-informed neural network, which is MLN, that incorporates multiphysical processes, including the electrophysiology, mechanical activation, and passive mechanics. So as you can see, so out of those three physical processes, electrophysiology, mechanics, and fluid dynamics, we include two of those three physical processes. So this is so-called cardiac electromechanics. So there are two physical processes describing the mechanical dynamics. So one is called mechanical activation. So this is in response to the electrical excitation. So the cardiomyocytes, which is contractile muscle cells of the heart, shorten, generating an active contractile force. And on the other hand, the passive mechanics, the contraction of the cardiac cells is influenced not only by the electrical excitation, but also stretching. So the passive mechanics only consider the contraction influenced by the stretching, but not the electrical excitation. So to represent various physical laws, we develop these physics-related operators using deep learning models to represent individual physical processes and their interplay. So for example, in this electrophysiology operator, so V is the output of the operator, and V is transmembrane potential. This is a variable representing the electrical dynamics of the heart. And D is the deformation of tissue, and this is a variable that represents the passive mechanics of the heart. So using D as an input and V as an output, so we can easily see how the passive mechanics interact with the electrophysiologies. And similar to the remaining operators, for example, the active mechanical activation using S, which is a cellular contraction state, as an output, and use the deformation of tissue as a input. And through this operator, we can see how the passive mechanics interact with the mechanical activation. So to represent, to train this MNN, so we create this loss function consisting of two losses. So the first is loss of physics, and the other is loss of measurements. So we compare in the loss of physics, so we compare the discrepancy between the output V generated by the MNN and the V generated by passing U through the electrophysiology operator. By minimizing these discrepancies, we ensure that the output of MNN follows the physical laws of normal cardiac function. And in the loss of measurements, so the first term phi is from the real data, and the phi hat is calculated using V given this formula. By minimizing this discrepancy, we can ensure that the output of MNN conforms to the real-world data. And this work is being under-reviewed in the Journal of American Medical and Informatics Association, which is JAMIA. So it is a prestigious journal in the healthcare domain. And in the experiment, we compare the intracardiac potential mapping estimated by the MNN and the real-world data at various time points during one heart cycle. So different columns represent different time points during one heart cycle. And the intracardiac potential mapping is the electrical potential on the heart surface. So you can see very similar patterns between these two rows. And further, we benchmark the results of the MNN with a single physics-informed simulation. So this single physics-informed simulation only incorporates the electrophysiology. So we call it ELAC-PNN. So the signal estimated by the ELAC-PNN is represented as the blue dashed line. So you can see that the signal estimated by the MNN has nearly the same waveform as the signal collected in the real world. And the signal estimated by the ELAC-PNN deviates from the real world data a lot. So these results demonstrate the effectiveness and the efficiency of using MNN to simulate the AF electromechanics. And build upon the proposed methodology, we also developed these virtual reality simulations as an educational tool for medical students and engineering students. So this VR simulation has two modes. So the first is trigger mode. So as you can see, this red dot represent the SA node, which is the normal trigger for the healthy heart. Well, this red dot on the left represents the AF trigger, which is the abnormal trigger in the AF heart. So in the trigger mode, there's both SA node and the AF node, both SA node and AF trigger work in the meantime. So this will generate abnormal signals, heart signals, which is AF signals. And under the ablation node, so we create these ablation points around the abnormal AF trigger. So once these ablation points are created, this will stop the propagation of the abnormal signal generated by the AF trigger. So in the first part of my research, we developed a multiphysics informed neural network to simulate AF electromechanics, especially the complex interplay of the multiple physical processes. And this accelerates the simulation of physics in cardiac physiology with the deep learning assisted physics related operator. And the proposed methodology surpasses the conventional methods, including the single physics-informed neural network and the numerical simulation in terms of efficiency and accuracy. And this has potential to enable real-time feasibility of the cardiac multiphysics simulation in the clinical settings. And the second part of my presentation today is about the survival predictions. So childhood leukemia is the most common cancer among children. It is caused by an abnormal increase in white blood cells that can crowd out the healthy blood cells. As the cancer cells increase, the bone marrow can no longer make enough numbers of normal white blood cells, red blood cells, etc. So in addition to the 31% morbidity, the mortality rate is also high, which contributes to about 39% of cancer-induced childhood death. So nowadays, advancements in treatments have improved the survival of the childhood leukemia. However, the development of early intervention approaches remains sketchy. So in the meantime, survival analysis is a set of approaches that can help us predict the progression of a certain disease. However, the existing survival predictions often rely on a single best model. So, and the current practice of developing these models only focus on improving the model performance metrics. Well, an ensemble of models with approximately identical performance metrics can exhibit variability in the predictive outcomes. So the model uncertainty is neglected in those predictions. And with model uncertainty neglect, the predictions can be less reliable. So to address these challenges, this research aims to take the model uncertainty into account in the patient-specific survival predictions, thereby tracking effects of the clinical attributes, better informing diagnosis and treatments, also improving childhood leukemia survivals. So specifically, we propose a Bayesian survival model that integrates the backbone survival model with Bayesian inference to take the model uncertainty into account. In addition, we use this Hamiltonian Monte Carlo method to estimate the posterior distribution of model parameters. So finally, we predict patient-specific survival probabilities for children with leukemia under model uncertainty. And this work has been published in Computers in Biology and Medicine back in 2023. So to validate the proposed methodology, we predict the survival probabilities over time for over 10,000 patients. Some of these patients do have death event occur, while the others don't. And these patients are classified into a censored group. And as shown in this figure, the gray lines represent individual survival probability. The green line represents the average survival probability for the censored group, and the red line represents the average survival probability of the deceased group. So as you can see, the green line consistently higher than the red line. So this means the average survival probability for the censored group, which do not have the death event occurs, has consistently higher survival probability than the deceased group, which have death events occur. So this suggests that the proposed model is robust to predict the survival probabilities accurately by considering model uncertainty. And to evaluate the model, we also calculate the concordance index, in short, C-index. So this is a measure commonly used to validate the predictive performance of the survival models. And the C-index measures the goodness of fit by computing the fraction of all pairs of observations with concordant predicted and observed survivals. So the C-index of the proposed survival model is 0.93, given the perfect value is 1. So this indicates that the model is of high precision. So we also investigate the effects of certain clinical parameters by calculating the average survival probabilities for each group. For example, we explore the effects of features including the age, subtypes of leukemia, radiation therapy, and chemotherapy. So these results indicates that this proposed model can help identify the effects of various parameters on survivals for the childhood patients. So the survival models built with machine learning or deep learning models demonstrate both accuracy and robustness in predicting the survival outcomes. However, because it is built on a neural network, which is often considered as black boxes. So explaining the predictive outcomes of the black box model, like deep learning models, is becoming increasingly important. So in this work, we develop an explainable transformer-based deep survival model to predict the risk of death for children and adolescents diagnosed with ALL. So this ALL is a particular type of leukemia, and it is called acute lymphoblastic leukemia. And this ALL is the most common cancer in children and adolescents, primarily affecting the white blood cells known as lymphocytes. And the disease is characterized by an overproduction of abnormal and immature lymphocytes in the bone marrow, leading to severe complications such as the organ failure, which can ultimately result in death. And this work has been published in Computers in Biology and Medicine in 2025. So the data set used in this research is sourced from the OU Health Cancer Registry, OU Health Electronic Health Records, and the Oklahoma's Central Cancer Registry. And this data set involves 275 children and adolescents diagnosed with ALL from 2005 to 2019. So the clinical variables selected for survival modeling including gender, histology, prognosis status, etc. So among these, all these 13 variables, OST, which is the overall survival time, and the event status serve as the label of the model, while the remaining 11 variables act as the input variable. So in this research, survival function is defined as a probability that a patient survives beyond a particular time point, which is TK as denoted in this equation. And the hazard function refers to the conditional probability that the patient experiences an event at TK given they remain event-free before TK. So we discretize the observed time into multiple time points and represent the time index by K. And we aim to predict the survival probabilities at each time point. And accordingly, our objective is to obtain a discrete survival function denoted as STK given x theta, and the hazard function, which is denoted as HTK given x theta. So in these notations, x is the set of variables, and theta is the set of model parameters. So given the two formulas of the survival function and the hazard function, according to the Bayes theorem, we can eventually obtain that the survival function as the cumulative product of 1 minus the hazard function at each time point. So with the proposed transformer-based survival model, the output layer can generate these target hazard function. And as long as we calculate the cumulative product of 1 minus the hazard function at different time points, then we can calculate the survival probability for a given time point. So we also design a loss function specifically tailored for predicting the survival outcomes related to death events using the cross-entropy theorem. There are two types of events we considered in the loss function, which are censored and the death event. So the deceased patient is assigned a survival status of 1 following the occurrence of the death event. And in contrast, the censored patient who do not have the death event occurs has a survival status of 0 until the end of the follow-up. So to minimize the loss, the proposed model consistently assigns high survival probabilities for deceased patients until their observed overall survival time and decreases the survival probability afterward. And for the censored patients, the model maximizes the survival probability up to their overall survival time because they do not have death event occurs. So by minimizing the loss function during training, we can then output survival probabilities for patients. And then we use this Shapley additive explanation to explain the proposed survival model. So SHAP is a model agnostic method that explains the output of the machine learning and deep learning models. So in this formula of SHAP, it is noted that phi j denotes the SHAP value for jth feature. And this SHAP value can highlight individual features' positive and negative impacts on the predictive outcomes. So in this work, we have this particular formula for the SHAP value phi j. So the Shapley value indicates the impact of the individual features on the final output of the transformer-based deep survival model. So note that the Shapley value can be either positive or negative. And when the Shapley value is positive, this means the positive Shapley values push the model prediction values higher, which is the predicted survival probability higher, while the negative Shapley value drives the model prediction values lower. So to validate this the model performance, so again, we first compare the average survival probability of the censored patients and that of the diseased patient. As shown in this figure, green line represents the average survival probability of the censored group, while the red line is the average survival probability of the diseased group. And each gray line gives the patient-specific survival probability changing over time. So from the plot, we can see that the average survival probability of censored group is consistently higher compared to that of the diseased group. And this suggests that the proposed model is robust to predict the survival probability accurately. And further, we calculate the C-index for the proposed model at 25%, 50%, and 70% quantiles of the event time. So our findings reveal that the proposed model delivers C-index scores of 0.923, 0.949, and 0.962 at these respective quantiles. And we also calculate the average C-index as 0.945. And these results highlight the robustness and the efficacy of the proposed research methodology, demonstrating the promising model performance in the patient-specific survival prediction for children diagnosed with ALL. And this figure presents the shape values for each feature. So as shown in the figure, individual data points are marked as either blue or red. So feature values are higher if the color tends to be red. So for example, if a patient has a higher value in age, so they will have a red color. If they have a lower value in age, they will have a blue color. So the clinical features are ranked from the most impactful to the lowest. So among these features, prognosis status, diagnosis year, and histology rank as the top 3 impactful features. So the positive Shapley value, as we just introduced, the positive Shapley value push the model prediction value higher, while negative Shapley value drive the model's prediction value lower. So as you may notice, so take the prognosis status as an example. So the prognosis status determined by the post-induction assessments negatively impacts the survival probability because high value in red drives the survival probability lower as it has negative shape value. So in the second part of my research, so we develop a Bayesian survival model with model uncertainty quantification, and this achieves robust and accurate model performance and offer well-informed decision-making on the prognosis and the treatment for children with leukemia. And then we develop a transformer-based deep survival model for patient-specific survival prediction. And we enhance the model interpretability using the shape analysis, and this can provide clinicians with more insightful findings. So in addition to the research work I just covered, so there are also many research directions that are of interest to the researchers and worth investigating. So for example, for the first part of my research, researchers are also interested in how multiphysical processes contributing to the arrhythmia conditions. So once we have these multiphysical simulations, we can collect the data from the simulation and utilizing these multiphysical data to analyze how the multiphysics process contribute to the arrhythmias initiation, maintenance, and progression. And on the other hand, we are also interested in investigating the initiation mechanisms of the cardiac arrhythmia. For example, in the atrial fibrillation. So if we could find the trigger of the atrial fibrillation, then we can have this targeted surgical planning by only burning the muscles around the AF triggers. So these are these are also two research directions in my group, and it is supported by my NSF career grant. And in terms of the second part of my research, so researchers are often interested in predicting a recurrence of the ALL, and this is because although the treatment advancements have increased the survival probability of the ALL, but relapsed ALL, which is a recurrence of ALL, is still the most common cause of treatment failure, with many deaths among pediatric patients. So these are the future research directions that are very interesting to the researchers in this domain. So if you are interested in working with me or collaborate with me, feel free to let me know. So we welcome all kinds of collaborations and partnerships. So that's all about my research. And thank you. And I'm happy to take any questions.
Thank you very much for sharing your research with us. If there are any questions, feel free to unmute and ask. Or if you're not able to use the microphone, you can add it to the chat. I guess people are still, oh, what was it?
Yeah, sorry, it's a little bit loud here, so I'm gonna try to, hopefully that's not an issue. I recently started getting into the survival modeling, and especially machine learning based ones. But I've only done a little bit with it so far, and I did kind of want you to elaborate a little bit on how the sensor data, the performance on the sensor data kind of shows the model robustness. I don't think I fully followed that part.
Can you say the question again? I couldn't hear you very clearly.
Yeah, sorry. Let me try moving the mic closer. I recently started getting into more survival modeling kind of things, and I've only played a little bit with them, but I don't think I quite followed how the censoring affected, or like, I guess estimation of model performance with the censoring affected the robustness, I guess. Can you kind of elaborate on that?
So you mean how the predicted survival probability of the sensor group validates the model's robustness?
Yes, yes.
Okay, so in my data set, or in my research, we define those patients who died at the end of study as the deceased group, and who do not have this death event occur as a censored group. So we are predicting the survival probability in terms of the death event, whether they can survive after diagnosed with the leukemia. So intuitively, those patients who have died at the end of the study or before the end of the study will have a higher survival probability than those patients who do not die during the course of the study. So if the average survival probability of the censored group is higher than the average survival probability of the diseased group, then this can be a validation of the proposed methodology.
Okay, that makes sense.
Everyone else, feel free to unmute, ask your questions. I guess while people are getting their thoughts together, I really liked your presentation, your research. It's not really my area, so I was wondering if on the variables you look at for part 2 of your presentation, would you ever group those into say things that are directly controllable by either the patient or the doctor versus those that aren't. So, like for example, you can't change your race or ethnicity on there, but you can change your distance to care, in some scenarios. So, yeah.
So these are not time varying variables. I know some data set that has these time varying variables. So over time, maybe they can change the gender, the age changes with respect to time. But in this data set, because it's collected by my collaborators, and it's quite challenging to collect these data from the patients and ask for their permissions. So these data set are just time invariant data. So we only collect the data when the patient visit the doctors. So they don't have the chance to change any of these values for their own records. So if at the time of visiting, the age is certain, the gender is certain, and the distance from to care is certain. So they are not changeable. Does it make
Okay.
sense?
Yeah.
Thank you.
And sure. Would you ever use, I know they were lower down on the list, like the impact list on your last slide, but would you ever use the results at one time step to say you need to move closer to care, like your distance to care needs to be smaller? Like use
Yeah,
it as a decision making for the doctors?
Yeah, so that's a very good point. So this model does it is able to provide such information, but we would like to not only rely on this data-driven model, so we want to also combine the clinicians' opinions when making the decisions or treatment decisions. So we kind of our expectation is to offer these results to the clinicians, and the clinicians utilize their expertise to see which part of the results are useful for them to make treatment decisions, and which part is not that informative or useful. So they do have this capability to provide such information, but it's up to clinicians to like whether they use it or not.
Okay, thank you. Would anyone else like to jump in? Farouk, do you have anything to add or questions? You're muted if you're talking to us.
Yeah, I have a comment. What Rui has presented is absolutely fabulous. And what is particularly interesting is that she has won a very, very prestigious NSF Career Award.
Thank you.
Gives very few of these through NSF. And Rui is one of those who has won this award. It's a 5-year award, and it's only given to people that the academic community believe have leadership potential. So I thought I'd mention this to you, that Rui is somebody who's special.
Thank you so much, Farouk.
So any comments from Prakash? Anybody else? Triet? Ted? Yeah, go ahead, Prakash.
I can only say that this is an interesting topic because the medical applications are really always great.
Thanks.
I'm also working in similar field, so thank you very much for the presentation. Thanks.
Yeah, thank you for the comments.
Prakash is in Canada. He's in Toronto, and he has
Wow.
2 roles. He's the director for R&D, or the dean for R&D at JKL Lakshmi University in India, and he's also working with medical companies and medical devices in Ontario, Canada.
Very nice to meet you.
Great.
Yeah,
Ted, anything from your end?
Rohit, I like your talk. I had to run
Thanks,
because I had
Todd.
the class
Yeah.
but it's very useful stuff, and is along the lines of my own interest. So I enjoy your talk. Very good, very nice talk.
Thanks, Todd. Yeah.
So from our side, we have an interested in the transformer model. And we will reach out to you on the transformer model, not applied so much here, but in predictive analytics. We are looking at how to predict the future state of the system.
Yeah, that works. Yeah.
Okay. And so our application is in coming up with public policy, how a system evolves, how engineering evolves, how a policy evolves. And so we have an interest in the transformer, and I'll send you a paper that we've just submitted for review for you to take a look at. And I'll put you in touch with the lead author on that.
Yeah, it sounds awesome. So I can also share some materials or information from my end. For example, this
Sure.
manuscript or anything else if you need.
Right. So back to you, Rodney. I'm going to stop recording after you've made your statement, and then we can do chit chat without recording.
All right. Well, I'll give one final chance, 3 more seconds. If anyone has any comments or questions, please unmute now and let us know. And with that,